Hello, today we're going to talk about falls. So in this lecture, we should be able to describe the importance of falls in older people and how to assess and prevent falls in an older person. So here are topics we're going to cover in this lecture. Um, Definition of falls is coming to rest inadvertently on the ground or at a lower level. And it uh, So one of the it's one of the most common events threatening the independence of the older adults. And most falls are not associated with single trauma. Um, but uh, they define the falls without the loss of consciousness in order to differentiate from sympathy. And one in three adults older than 65 years report falling each year. About half of all adults older than 80 years fall each year. The one half of nursing home residents also fall each year. Among those with a history of fall in the previous years, any incident of fall is close to 60%. Complication falls are the leading cause of death from injury in people older than 65 years. Regarding the morbidity and the mortality, 10 to 20% of falls by older adults result in fracture or more serious soft tissue injury or head trauma. The death rate attributed to falls increased with age. Mortality rate is high uh, among the white men aged more than 85 years old. The cost of the force is very expensive and it's associated with declining functional status, nursing home replacement, the increased use of medical services, fear for. And in 2015, the total medical cost for related injury is more than $50 billion. Uh, the causes of fall really due to a single cause, maybe due to accumulated effect of multiple impairments and uh, uh, and they have a complex interactions of intrinsic factors, including age-related physiological changes, chronic diseases, and medications, and the challenge to both to control environment, changing positions, and routine activities, and also some mediating factors, risk-taking behaviors, few units, observational hazards, and etc. So regarding the intrinsic risk factors, including older age, cognitive impairment, female gender, personality history for hypo vitamin D, vitamin D toxicity, food disorder, balance problems, psychotropic pain, Parkinson's disease, stroke, arthritis, the risk for increases the number of risk factors. And so the age related to the decline of physiology physiological changes in the older adults, including visual function, pre- proprioceptive system, vestibular system, regulation of medical blood pressure, postural control decline. So all of this reflects or control system uh, and, function decline in the older animals, and also reduce to the body water issues for the falls. So the medication used here is a list of different kinds of medications that can trigger the fall. Blockers, tolerance, Butalol, antidepressants, histamine, cholinergic drugs, antimuscarinic, incontinence agents, antipsychotic agents, control, ibuprofen, dementia medication, insulin, muscle relaxants, non-benzodiazepines, opioid, Parkinson's drugs. So the clinical guidelines for for the floor, which is we encountered the patient, which is for older adults about 4 to 5 years, hospital if they have any fall in the past 6 months or past years. And if it's a single fall, check for balance due to disturbance. If a patient has a recurrent fall, so giving balance disturbance, we should pursue a multifactorial fall risk assessment. The CDC has said the algorithm website that allow the patient to go to the website, answer the questions, and then finally they will evaluate the answer and give patient a score to see if patient has a high risk of fall or not. And the components of fall history, including history of falls, activity at home of falls, program symptoms, location of time falls, medication history, also some environmental factors like lighting, floor covering, grills, furniture, door, threshold, footwear are all related to the falls. Regarding the footwear, so the most surface foot can touch the ground, the most stable, so patient will have a lower chance to have fall. While the lower area touching the ground, for like a high heel, wear that can definitely give patient a high risk of fall. And also patient use a hard uh, use a hard material to make the store area. It can also decrease falls, and for the sleep resistance sole, it can give benefit for most of the older adults, except for the patient who has a shuffle heat. This kind of sole material will give high risk of fall. So for physical exam, the most important part includes the assessment of the integrity of the musculoskeletal function. So here are the first three tests that we normally use in the clinic. We value the patient as the highest for the rest of three we normally just use for research purpose. So regarding the up and go test, just let patient sit in chair without using arms, and let patient stand up and uh, move, go forward for about 3 meters and turn around and come back to the chair and sit back again. So during this process, a patient cannot complete the process within 12 seconds, the patient will have a high chance of fall. And also as a healthcare provider, you should protect patients from fall during this process. So just make sure and make sure protect. You need to stand aside from the patient and because they won't fall in this test. And chair stand, so that let patient cross their arms in front of the chest and stand up and sit in chair and repeat this whole process and for 30 seconds. If patient is older than 75, 79 years old, this process should be and if the male patient, they cannot finish it for 11 sets, or female patient cannot finish it with finish 10 sets. All of this give them higher force. For sleep balance test, so just let patient stand up and you put in 4 different positions to stand. One suggests feet, otherwise tandem, semi-tandem stance, and a tandem stance, and one foot to see if patient can keep balance. If not, if patient cannot keep balance on one foot position for about 10 seconds, so the patient also has a high risk of fall. And so, as we mentioned, the rest of the really complicated and mainly for research purposes. So you are really interested in it, you can definitely go to the YouTube and check how to perform those tests. And the laboratory and the diagnostic testing, we should be guided by the history and physical exam. And you can do the echo, brain image, radiographic that is and if you suspect patients to have any heart problem, neuron problem, nerve problem, uh, or, or peripheral nerve problem related to spine issues, and also the lab tests including hemoglobin, urine, creatinine, glucose can exclude if it's anemia, dehydration, or hypoglycemia, hypoglycemia, and also heart monitors are also useful uh, to monitor patients has a heart arrhythmia. That's not a proven value for routine evaluation. Cardiac sinus must start. It continues heart rate and BP monitors advocated by some patients. The Einstein force can cover cardiac sinus type of sensitivity. So this one we should be using very caution because some patients have a history of a stroke, or if you can listen to murmuring the cardiac arteries, or if the patient have about the infection. So this manure it's uh, really dangerous. So it can cause a severe cardiovascular events. And also for the prevention, the guidelines would including um, identify the interventions to prevent falls in community involving elders. So they should prescribe exercise, particular balance, strength, fatigue training, discontinue or minimize psychoactive and other medication, manage the postural hypotension, food problems, food wear, supplement vitamin D, but be careful, don't overdose patients. Treat breathing impairment, manage heart rate and rhythm of downtake, modify the home environment. Interventions for lowering fall risk by side of care in the home, including muscle strength and balance training, um, and we can also do the adaptation to Tai Chi to strengthen their muscle and the home tether assessment and prescribed for those with history of falls, multidisciplinary multifactor health and environment risk factor screening or intervention, and elected community development or unselected community development older adults with history of falling, or older adults that got no risk factor. And also it contains withdrawal psychotropic medications, include the yesterday review of medications rule out the polypharmacy effects or drug interaction or the side effects of the medication because force. Vitamin D supplementation the more than or 800 units per day person with vitamin D deficiency. The first under the cataract surgery, eye surgery, when indicated the patient has a problem. And in the hospital, many risk factors have reason for sensitivity and specificity to be of potential value in targeting high-risk patients. Multi-factor interventions target individual reduce the risk factors for falls, including plans that use health information technology have been effective in reducing falls. In the nursing home, no proven interventions have been reported other than vitamin D supplementation. Reasonable to assume all nursing home residents at high risk of falls and to calculate the residents' most important individuals' risk factors. The user interprofessional team vitamin D supplementation at more than 800 units for resident independence and transfer at the risk of falls. Exercise programs may reduce the risk of falls as well. So here's a summary. Falls by older adults are common, usually multifactorial, and associated with functional decline. Screening and the targeted preventive interventions are most effective. AJS falls prevention guidelines are available and recommend multifactorial intervention. So here's a question. A 78-year-old man with a moderate Alzheimer's disease is hospitalized for pneumonia. The ship nurse reported that he tried to get out of bed without assistance. She is concerned that he may fall. On field exam, he is alert and able to follow a simple command, and he attends to the interview. Which of the following is most likely to reduce the patient risk of falling? A. Placement person at the bedside. B. Low bed. C. False education for nurse. D. Intervention to prevent delirium. The answer is B. Intervention to prevent delirium. Because if patient has dementia, remember, so as patient dementia, so they have a high chance to have a delirium and also have a chance to get fall. Place the person at bedside with no benefits based on research. On the low bed, they increase the risk of falls because the patient may need to use more strength to get from the bed, or it's also very inconvenient for them to lay on the bed. And the false education for nurses won't give any benefit for the patient who has dementia. So basically, those patients cannot be teach if they have a dementia. So cannot be taught. And here's the second question. An 81-year-old woman is brought to the office because she has fallen outside of her home 3 times in the past 6 months. History includes hypertension, osteoarthritis, decreased vision due to cataracts, and medications including lisinopril, topical diclofenac, and multivitamins. The patient used a cane to live with her daughters independently in ADLs and attends programs at a senior center with a friend several times each week. On physical exam, blood pressure 135 over 80 and there are no postural changes. Heart and lung findings are remarkable. Quadriceps experience mildly reduced bilaterally and she's unable to stand on one leg. Gait is steady but slow, with decreased full clearance, both with and without the cane. Uh, which following most likely to reduce her forest? A. Medication review and reduction. B. Of, ophthalmology evaluation. C. Vitamin D supplement. D. Information on forest. So the answer is B. Ophthalmology evaluation. Because this patient has some vision problem, and also definitely, if you can see the history, decreased vision due to cataract. So this one is it is a high risk to fall. So definitely, a patient that can have a surgery to treat that problem, it can definitely decrease the risk of fall in the future. Medication review and reduction is unnecessary because this patient only have like 3 medication won't cause any uh, uh, polypharmacy issues here, and also uh, vitamin D supplement is also unnecessary for this patient, and compared uh, compared to the eye surgeries, I mean this one is not that this one is not that urgent that the patient needs to prevent the fall. Information on fall risk for the older adults with no benefits based on the research report. So, so that's all for this topic. So if you have any questions, please feel free to leave your feedback on the questions so I can get to answer it. Thank you. Have a good weekend.